traumatic event.
Sure. Is there, some barriers that perhaps are preventing people from getting the care that they need?
Well, after a traumatic event, sometimes people are just busy managing the physiological effects of that. If they've been in a car wreck or maybe are dealing with some injuries or something like that, they might be dealing with a lot of life factors like time off of work, and they're just too busy to kind of slow down and really address that. Or they think it's just regular, like normal stress that we have from, just day-to-day life. But really, these are factors that are sometimes associated with a really scary and traumatic event, and there's treatment out there for everyone.
Sure. Well, I mean, like we said, it can impact people at any age. Or, I think of like kids who might not think that PTSD is something that might be affecting them at a younger age. Are there things that schools or caregivers can be doing to help?
In children, sometimes PTSD will show up, as sleeplessness, bedwetting, just kind of regression to an earlier stage of development. So if parents are seeing that after a child's gone through, say, maybe a scary medical event or a car accident or something like that, those are great things to bring up to your pediatrician, to kind of ask, is this a medical situation? Is this just a developmental stage? Or is this something that maybe we can address with some therapy or other support?
Right. No, those are important things to ask. And just last question for you, are there any misconceptions about PTSD that you would like to address that you think people should be aware of?
Yeah, I think a lot of times people think that PTSD is more, for combat veterans or people who have experienced, violence or, a crime or something like that.
Sure.
But a lot of times people can develop symptoms of PTSD as related to medical events, whether that's a serious medical diagnosis for themselves or for a family member, witnessing a family member go through a scary medical experience like cancer treatment, or for parents who have been through a difficult delivery or staying, NICU care for a baby or something like that. So if you're noticing those symptoms of feeling irritable, having trouble sleeping, having a lot of thoughts or memories of a scary medical event or any event at all, definitely reach out to your healthcare provider. Or you mentioned the Center for PTSD for Veterans. That website, the National Center for PTSD, has a lot of great online support apps for people who are experiencing those symptoms that are totally free.
Wonderful.
For everyone in the community.
Wonderful. Well, Jen, we appreciate you being here and helping us raise this important awareness. You can always watch all of our interviews on our website. They're important. Just head to cbscolorado.com.